Assalamu alaikum. In this video, we will talk about the counseling process. We will be addressing certain questions which include: when do patients need counseling? The aims or the goals of counseling? What should be the belief of the person who is doing the counseling? And the stages of counseling. Moving on to the first question: when do patients need counseling? Patients need it when they have to make certain decisions. But sometimes these are very difficult decisions. For example, if they have to come across an intervention in management which is going to affect them and their family members financially, physically, or mentally. Management where long-term care may be required or where surgery may be required. Some examples are in vitro fertilization, treatment, management of ectopic pregnancy, diagnosis of cancer, treatment of sexually transmitted diseases including HIV, end-of-life care, or if you have to turn off ventilatory support for a patient. The overall aim or the goal of counseling is to help people, to help them to understand their medical problems and the management of these problems in a better way so that they themselves can manage their own problems, and so that they can mobilize their resources that are available to them in the form of family members, financial help, to overcome the problem. Another thing that physicians see is when a certain diagnosis is made, patients sometimes start feeling very depressed. To stop them from going into a spiral of depression, it is important to talk to them about the positive way to react and the positive aspects of their life. Unless the patient can think positively about their problem, they may not be able to change their behavior. What should be the belief of the counselor? The counselor must believe that behavior is learned and can be changed. The initial concern is to help the patient analyze behavior, to define their problems and select goals. An example of this may be a person who smokes cigarette or chews tobacco. The counselor has to recognize that every individual is unique and they come from different backgrounds and they have a certain set of beliefs which we can't really understand or anticipate or even comprehend. The environment plays an important part in determining the behavior of individuals. Responses to a given situation is due to behavior that has been reinforced as a child. We need to help people to explore their own thoughts and work on their solutions. An example is that if a patient is coming from a village, she may not have the same responses as a well-educated person who is coming from a city or from some other place. People carry within themselves the capacity to grow emotionally and psychologically towards personal fulfillment. And the physician can encourage self-awareness and self-realization. It is important to understand and to make the patient understand that if anything negative has happened in the form of a life event, then it does not mean that the response should also be negative. The response can be very positive to overcome the problem. What are the stages of counseling and how do you start? How do you approach the problem and how do you end the counseling session? There is a need to develop a client and clinician relationship. Information has to be gathered from the patient. The patient needs to understand the problem and Together with the patient, you have to identify and set counseling or treatment goals. Help the patient plan the decisions, and at the end of the counseling sessions, you need to summarize and then follow up with further sessions or with further visits. To develop the client-clinician relationship, introduction is important and establishing rapport. The environment should be clean, it should be comfortable, and it should be a good environment. And you must give eye contact to the patient. Give respect to the patients by talking to them in a setting where there is confidentiality and privacy. Allow the patient to also bring in their suggestions and to negotiate their treatment with the physician. The physician will have a cut and dried management plan, but there will be a certain element of negotiation which will be involved. Observe verbal and non-verbal cues. This is gained with experience, and a good counselor should be sensitive and responsive to emotions. Sensitivity can be a good thing, such as respecting the person in front of you, or a bad thing like getting sad and upset over any slight thing. The physician cannot afford to get upset or sad. Psychologists have defined 6 basic human emotions, which include sadness, happiness, fear, anger, surprise, and disgust. But other psychologists have taken it further and to say that there are 12 or even 25 distinct varieties of emotional that are preserved over cultures and which correspond to adoration, amusement, anger, awe, confusion, contempt, desire, disappointment, distress, fear, interest, and sadness. So it is very important that physicians, as they gain more and more experience, to understand how patients are responding and to modify their discussion, their counseling process accordingly. So as you can see in this picture, this patient here is obviously listening with great attention, but this patient here is not really happy, and you can see that the arms are crossed, and there is some lines on the forehead. And another patient here is quite frankly very angry, and her legs are also crossed. So these things are picked up with experience, but it is important to pick them up and to use them in a positive way during the counseling process. Gathering information from the patient is crucial. We need to understand what does the patient and her family members feel about the problem and understand the problem, and allow them to talk freely, ask questions, and express themselves. We must use open-ended questions: why, where, when, what, and try to understand the patient's world, where she's coming from, whether she is coming from a low social status, a middle class status, whether she's educated, uneducated, whether she's financially independent or not financially independent, who are the people around her who can help her. So we have to understand the patient's world, and these ideas will come across as you talk to the patient, and the more freely you talk to the patient, the more freely she will talk about her own circumstances and help you to understand which world she's coming from. Help the patient to understand the problem. Obviously, this part, there is a great responsibility of the physician to use lay terminology, not to use medical terms, to make the patient understand in simple words in the problem and how we can try to help her. You can even share information in the form of leaflets, or you can have certain sessions. For example, you can have classes on antenatal care where patients can come and listen to all the different aspects of antenatal care that are required, and bring their husbands in and talk to the nurses or the physicians who are conducting these classes. At the end of the counseling session, it's important to summarize it is important to have certain goals, and these may be short-term goals or long-term goals, and there should be a follow-up plan. Remember, the process of counseling should have a respect of the patient's privacy, confidentiality, should have respect for that the fact that every patient is unique and coming from a unique background. It must be mutual. If the patient starts to say unpleasant things to the physician or shout at the physician, you cannot really continue with that counseling session, because unless there is respect and trust between both parties, a counseling process cannot take place. In such a situation, you may decide to stop and then say to the patient whether they would like to speak to someone else, for example, a more senior person or somebody from management if they are angry. And so respect has to be mutual. A very, very important point is to not to be judgmental. Don't judge people by the way they dress, by the way they talk, by the questions that they ask. If they are ignorant about their questions or ignorant about other things, if they are non-affording, you cannot judge an individual. A human being deserves respect, and a human being has rights. And unless and until the counselor believes this, then only this is the first step for the counselor to become a good counselor. So in the end, I would just like to say that this and as other such talks are available on my medical channel, YouTube channel called Aqorn Learning, which all has the handle of @Rahat 2021. Please feel free to go to these videos and to learn from them. Thank you.